As program director, the most important thing for me is to make sure that I train residents to be the best radiologists they can be. So I will push you, but I also want you to feel like you are growing into a part of a family. Because the most important thing for me is not just to have you educated, but to have you come and thrive in my program.
There's obviously an emphasis on education. And of course the professors are always willing to even meet with us one-on-one. Dr. Maurer, for example, meets with us for 2 hours for every one of our MSK rotations, just to go over the basics and what you might see on call. And I think it's pretty unique to our program. I don't know of any other programs that have that one-on-one time for the education. And then also I feel like it's an environment where everyone wants to know who you are. It's more than just, you know, how do you do your job and do you do it well? It's who are you? What makes you happy? Are you feeling okay? Are you doing okay?
You have the opportunity not just to interact with medical students and residents, you also have the opportunity to interact with high school students, orthopedic residents, residents from the PM&R division. And so you have this beautiful opportunity for our residents to teach and learn from other residents, and also to teach and learn from other individuals who are at different points in their career. I think it's a rich, wonderful experience, and it's really, really unique because our program really is small, really is focused on residents, and really is focused on training. I think you get this wonderful perspective of the multiple layers involved in really understanding the material that we're learning and how best to take care of our patients.
Having a young daughter at home, I feel very supported by the faculty. You know, if I need to take care of her for any reason, they're very supportive in letting me take time off or switch shifts if needed.
I think that it's really easy to say that resident wellness is important and everybody just sort of says it, but I feel like it's been proven a few times to me just since I've been here. We have an educational committee that is for the radiology, and they ask students to be members of it. And we volunteer, and every level is in that committee, and during these meetings we really get the floor. We get to talk about whatever is concerning us, and we don't have to be afraid that somebody is going to think that we shouldn't be speaking about it. And then they go to bat for us. And so I've seen this happen during the meetings, and I've seen it happen after the meetings. It's been really impressive.
I think one of the best things about our program in terms of promoting wellness is that we have a very active wellness committee. We have a very generous fund that helps us sort of support these team building activities and our social outings as well.
So here at MedStar Georgetown, we actually have a great peer-to-peer mentoring program where each new resident is placed into an already established house that consists of residents from each PGY level, as well as residents from the diagnostic and interventional radiology programs. It fosters great camaraderie between residents, as well as we have a little bit of friendly competition between the houses. We earn house points throughout the year, and then whoever wins gets to hang their flag high and has bragging rights for the next year.
DC is a great city for young professionals, I think from different fields. So whether that means being in medicine like us, or in the research aspect of it, working at the NIH, which is also close by, or other fields from politics to economics to, there's really just tons of young professionals from all different areas. And it's amazing to get to meet some of those people and see what they do day to day and form connections and friendships with them.
I think the most valuable experience during training is the fact that we take independent call. It's a time that we learn the most, especially seeing unique cases throughout the night. And it's a time that you get to develop your own style and read cases independently over the course of the night. But I think it's also nice to have the comfort of being able to reach out to an attending at any time if needed.
Washington, D.C. is a very diverse area, not only in terms of many different cultures that are in the area, but also within our MedStar Georgetown program as well. So what's important to us is that we recruit and maintain a diverse training program as well as faculty, and that's important to us because we know that diversity in thought, in cultures, in perspectives really brings so much to education and to the experience of our residents.